Ship owners and ship managers have utilized remote physician advice on an emergency basis. What Future Care's telemedical program has aimed to provide is the opportunity to go much further. Medical oversight that begins with primary care keeps our seafarers healthy and secure in the knowledge that they are being well taken care of.
Trying to develop a model of care which is the same as for all land-based industries.
This seems like a population that is underserved. It's kind of invisible to most people. What we really want to get at is to come up with some interventions that can help reduce the medical events, reduce the costs, and have everyone healthier.
We've got the telemedicine kit, which you see here, which is the device which has a number of medical devices that can be used to enable the video telemedicine.
That we're able to collect data from the onset of any illness or injury, and we encourage our seafarers to report even the most minor incidents that occur on board the vessel.
The Future Care database covered 6 years of data, 105 companies, over 900 ships.
We need to get the data combined so we know what are they going to work with, what's happening on board, what can we as operators do preventatively so we're not sending them home and flying them home.
I look at the numbers and see who's at risk, who is not at risk. And when we get more data, we eventually will be able to predict the risks to lower down the illnesses there.
On board a vessel, one person gets sick, everybody's sick. So the start of our wellness campaign was flu and cold prevention. To start changing the mind, which leads to a changed behavior.
Changing behavior is hard, but if we don't try, we're not going to do it.
There is going to be a big savings from doing an early intervention or a wellness checkups at sea.
I think Future Care is just leading edge and caring for our crews. And I think it's important because when we look at recruiting retention, our crew members want to be okay.
Well, you can certainly have a wellness checkup on board your vessel once that crew member has boarded. So we're really driven by wanting to find new techniques, new ways, new methods. And it's ship owners like yourselves and our friends in the audience that are really helping to drive that change.
You could probably come up with a system that would flag somebody to say, we're worried about this person, just by putting in the every 2 weeks or every month or every 3 weeks data.
But this kit does include a blood pressure monitor, an EKG reader. It's got a micro camera that you can zoom in and get high quality images of any body part to get to the doctor. So you've got both eyes and ears of a doctor on board.
Every day there is monitoring until the captain and the physician themselves say, okay, fit for duty.
We've seen that the earlier things are reported, even someone who has a chronic condition, he's likely to not have an episode if he's well managed.
You're talking to a doctor 2-3 times a day.
96% of those cases, our doctor says, stand down, captain. No need to evacuate. We will continue treatment on board.
And our goal is keep them on board if they can work.
This is what's going to bring us to the new level of care and the new level of management of cost with care. We have Dr. Rafi Lefkowitz from Yale School of Medicine in the audience, and he's also on our physician call line. And I'm wondering, Dr. Lefkowitz, if you might render a few opinions on what we're speaking about today.
Sure. I've been on the call line for a couple of months now, and it's actually been really, really satisfying for me to be able to take care of people all over the world who otherwise had no option. And so I think the most important thing I could speak to is that it's really gratifying. And the feedback that I get from the captains and from the crew members is basically a huge sigh of relief for these people that otherwise felt like they had no one to turn to. I think I've seen both extremes, from a couple minor injuries that just require a little bit of ibuprofen, get better within a couple of days. And there's been some infections people who get some lacerations or more severe looking, basically knocking into heavy objects and that kind of thing. They can get some more severe injuries. And then all the way to somebody had to evacuate the other day for acute appendicitis. I usually get the information because they want to see a physician who answers their questions. So I think I'm mostly getting people who are freely open with what their conditions are, and if I need additional information, I usually get those answers. So I do think that there's a lot of trust that for future care is provided between the connection here.